Hello and welcome to the EMExeter Carecast. My name is Gavin Lloyd and I'm joined by my two lovely colleagues, Steve Fordham.
Hello.
And Adam Rubin.
Hello from me.
So we're all emergency physicians down here in Exeter in the southwest of England.
A key recommendation of the Francis Report, the government inquiry into poor quality care in the acute NHS hospital, is that all staff should contribute to a safer, committed and compassionate and caring service.
Do we?
Do you?
We think this Carecast will be enjoyed by anyone interested in improving the care of their patients in the emergency department.
We're going to concentrate on four themes. These are:
the meet and greet. Senior doctors take special notice.
Skincare. This one is mainly for the nurses.
the waiting room. You might want to show this one to the business manager. And
tea.
Did you say tea, Gav?
Yes, really, tea. More of that later.
We'll also point you in the direction of our EMExeter website, which has useful information on lots of other aspects of care that you might want to consider.
So let's start with the meet and greet. This, we'd argue, is the first and most important part of the RAT process.
RATing, that's Rapid Assessment and Triage, where a receiving team takes a paramedic handover and rapidly makes a clinical assessment of the patient, orders some tests, or not, and triages the patient.
Before we introduced ratting, there was a paramedic to a majors triage nurse handover in the open department. Now we have the same handover led by a senior doctor in a bespoke rat room, but with real emphasis now on a warm and welcoming smile and a handshake. That's the meet and greet. Think of it as ratting plus. This process has got four main aims. Firstly, the meet and greet with a welcome and reassurance from a senior clinician, usually a consultant. There's a multidisciplinary handover with the paramedics, the nurses, the doctors, but most importantly, the patients and their relatives or carers. You've got rat-directed investigations and tests to speed up the patient's journey and flow. And finally, there's what I call the rat-informed dispatch, telling the patient about their likely course so they know from the outset what's likely to happen to them, rather than having to wait several hours. And that's priceless in terms of care.
If you have a look at this picture, that's Chris, one of our colleagues, in the old rat room. He's not actually shaking the gentleman's hand, he's holding it. Get tactile. Feel their pulse, usually for no other reason than giving them reassurance, and tell them that they're being looked after.
Following your clinical assessment, explain to the patient what you might think is going on. Offer them a drink of water, some analgesia if they need it, and forecast. Tell them if they're likely to be admitted, or what steps they might need to go through in order for them to go home.
Recently, we've introduced the CAT. This is children's analgesia and triage with vital signs. Local and college audits have shown that analgesia and the recording of vital signs at triage and repeating them when appropriate are areas of good quality care that we should focus on.
Let's move on to skin care. Gents, how many of our patients who get admitted are on trolleys for ages?
Not as many as you think, listeners.
I've got Caroline Dowse, our senior nurse, here with me today. Hi, Caroline.
Hi, Steve.
Pressure ulcer prevention has risen higher up the agenda for nursing care, with campaigns like Your Skin Matters being launched by the Royal College of Nursing in 2012.
It's really important for staff in the emergency department to remember that pressure ulcers can begin to form after 2 hours if the patient is immobile or being cared for on the wrong type of mattress. Importantly, those on a spinal board have been shown to develop pressure sores within 20 minutes of actually getting on there. It's imperative that pressure ulcer prevention, it starts in the emergency department.
And can you tell me a bit more about the review you published in 2015 titled The Emergency Department Response to the Pressure Crisis?
Yes, this article stemmed from an incident that we had in about 2012 when an elderly lady was on a trolley in the emergency department for approximately 5 hours with little or no movement to her heel. She developed a grade 3 pressure sore to her heel. Following on from this, the Trust did an investigation and we were asked to work with one of the tissue viability nurses from the Trust. We were extremely fortunate that the tissue viability nurse that we worked with had an emergency department background, and it was really, really helpful in implementing and trialling all that he was planning to do because we felt that he got it, he understood. Together we trialled and developed the Exeter pressure risk assessment tool.
So, what happens to our patients when they come into the emergency department now?
So, when patients come into the emergency department, they get an early skin assessment, and that may be as simple as actually just looking at our patients and seeing that if they're elderly, for example, and there is no need for any abdominal hip x-rays, that actually they don't need to go onto a trolley, they can go straight onto a bed. If a bed isn't available to them, then we can put them on a topper mattress on one of our trolleys until a bed can become available. The patient also has the documented rapid skin assessment, and this identifies those that are at an increased risk of developing pressure damage.
And what about patients who have got a clinically suspected neck of femur fracture?
Well, we have an arrangement with the ambulance service, and they pre-alert us to these patients. As soon as the alert comes in, we start to inflate an airwave mattress for them. In the meantime, we make sure that we have a topper mattress ready for the patient, and these topper mattresses reduce the likelihood of getting pressure damage, but the most important thing about them is that you can actually x-ray through these mattresses. Once the x-ray diagnosis is confirmed, then we move the patient straight onto the airwave mattress.
Thank you very much, Caroline. That sounds brilliant.
Thank you.
It makes sense, doesn't it? The patients will be waiting for up to 4 hours in the emergency department, and maybe longer. Get them onto something that limits skin damage rather than an ED trolley.
The waiting room. That waiting room looks pretty plush, fellas.
Yes, sadly, it's not ours, but we have made lots of changes in order to enhance the patient experience.
What about some examples, Steve?
Displaying the waiting times. From our patient surveys, we had a few negative comments around how long am I going to have to wait.
So now we've installed a visual display, and our reception staff are doing a cracking job in updating this hourly.
And what's this, Gav?
Well, some of our patients' feedback concerns was that their name would be called whilst they popped out to the loo or were outside feeding the car parking meter.
So Jeanette, our senior nurse, cobbled this together and these are displayed widely around the waiting room.
Speaking of loos, some other patient feedback related to how clean the loos were.
Or weren't.
Dodgy bogs?
Especially when Mr. Norovirus is in town.
So what have we done?
Well, funnily enough, they've always been cleaned on a regular basis, but we now display a cleaning diary for reassurance.
Very corporate.
Very clean, gents.
It's probably worth mentioning a few other creature comforts we've provided.
Yes, a telly. Can you believe we didn't have a telly?
So that's the BBC News channel on silent with subtitles running across the bottom.
Why is it on silent?
Because we've got Led Zeppelin coming out the speakers. Free Wi-Fi.
First department in the hospital.
A bookstore?
You must be kidding. Surely the books get nicked.
Not so. We pinched this idea from the ED up the road in Taunton. 50p a book. We get staff to bring in their offloads. We've raised around £200 for charity this way.
Our research nurse Jenny's done a marvellous job there.
And magazines too, all bought in by staff and distributed around all the waiting areas in the department.
Is that your copy of Big Issue in there, Gav?
You bet.
Any other changes, fellas?
Indeed, for health promotion purposes, we've turfed out the enormous Coke and Sweet vending machine and put in a smaller, quieter one that sells some decent stuff.
You may have heard TV chef Jamie Oliver has urged ministers to be big and bold by introducing a sugar tax on fizzy drinks. This is on the back of growing public concern about the changing impact of sugar on health, from the state of people's teeth to type 2 diabetes and obesity.
And we've installed another TV that does some health education stuff, including fire prevention, and a custom animation that gives inpatient patients really useful information about their journey, the steps they might go through, and some of the personnel they'll encounter.
So you mentioned about tea, Gav. Why have we got a picture of a cup of tea?
Because we're British, Steve. Do you know of any better way of raising someone's spirits? You know the old girl's eyes are going to light up when you offer a cuppa.
So what have we done?
Well, we've really raised its profile. offering food and drink in general in a timely fashion.
We've encouraged senior doctors and nurses to identify early from the ratting process which rare patient genuinely needs to be nil by mouth. Everyone else, get them fed and watered. Even those patients going for surgery can have a sip of water.
Don't they call that comfort rounding on the wards?
More like impromptu care in the ED. We've just made it clear that it's everyone's responsibility to deliver, not just offer tea. In fact, I've ceremoniously paraded a cup of tea for a patient in front of the staff a few times.
And what about trolley rounds?
That too, getting the lovely ladies who tour the hospital to get to the front line twice a day. And of course, they can go out to the waiting room as well.
So, in summary, we've covered 4 areas that you might want to consider when focusing on care in the ED.
A real emphasis on a warm welcome as part of the RAT process. The meet and greet.
Using mattress toppers for fractured neck of femur and getting patients with vulnerable skin onto beds or airwaves as soon as possible.
We've shown you some changes to our ED waiting room.
And finally, we've promoted tea.
Look out for other care initiatives we have up and running on the EMExeter website.
Thanks for listening.
Take care.
That's too corny.
All the best.